In the last decade, breast augmentations in the U.S. have nearly tripled. Last year alone, nearly 300,000 women had surgery to enlarge their breasts. About 100,000 had reconstruction with implants after breast cancer. So I sat down with Dr. Susan Vasko with Columbus Aesthetic and Plastic Surgery to find out what you need to consider before going under the knife. We are here at the Upper Arlington office of CAPS, and today Dr. Susan Vasko and I, we're going to be talking about breast augmentation. And I want to start by saying this is probably still one of the most popular procedures people have, isn't it?
Yes, it is a procedure where we see women of all age groups, lots of different reasons, both cosmetic and reconstructive. So week in, week out, it's the sort of surgery that's being done by plastic surgeons.
And you mentioned it's not just done for cosmetic reasons. I'm a breast cancer survivor, obviously. I found myself in a plastic surgeon's office. Reconstruction is a big issue for what you guys do to help make people just feel better about themselves, isn't it?
When I see people that have breast reconstruction, which typically is started these days at the time of the mastectomy, what I feel is happening is that it's an important part of the recovery. So you have, you've gone through the diagnosis, kind of coping, with those sorts of issues, but it's a way to help in the healing process and see that steps are being taken to get you to look back to normal as much as possible.
And as far as when somebody comes in for a breast augmentation, people start maybe younger these days. They try to, kind of get ahead of the game. Who would you say would be the best candidate, or when should somebody first think about getting a breast augmentation?
The ladies that I see that are younger, maybe in their 20s, oftentimes really just have nothing. And so they might be physically fit and happy with everything else on their body, but just an A cup and hard to find a bathing suit that fits, hard to be balanced in their clothes and things like that. The second group are a little bit older, women who are done having kids, and they'll come in and say, well, when I was breastfeeding, I was a full C cup, and now I'm a small B cup, and I just want to have, what I
want what I used to have.
I want what I used to have because I got used to it. And
one of the things too, many people I'm sure ask, silicone versus saline. It's kind of been the debate. Silicone for a little while got kind of a bad rap, but now, that's not so much the case, right?
Right. In 1992, the FDA removed silicone gel implants off of the market for use for cosmetic patients. The FDA looked at the literature. We did data collection for about 10 years, and then it was analyzed, submitted back to the FDA, and they looked at the data and said that it's safe to put the silicone gel implants back on the market for the cosmetic ladies. That implants do have a set of risks, both saline and silicone gel, and those are the things that we talk about in the consultation. But what I see currently in 2015 is for someone coming in for cosmetic breast augmentation, probably 95% are back using silicone gel implants.
Because of the natural look, and you guys talk about that, I'm sure, during a consultation. So let's talk recovery. When somebody goes through this, what do they have to know post-op?
There are several things that they need to know. The first is there's a period of recovery just from postoperative pain, and I tell my ladies probably 4 to 5 days of taking pain medicine. I like to see about a week and a half off work if they can do that. Longer if they have a very physical job. My mantra is low impact, lower body. So if you want to walk and you want to walk on a treadmill, you want to ride an exercise bike, those sorts of things are fine. But we're not looking at running, Pilates, weightlifting, any of those things until they're really about 5-6 weeks out.
And as far as how long they last, should somebody be looking to replacing them at a certain point?
The issue is you really don't need to replace unless there's a problem. And my feeling is that saline implants probably lasting about 10 to 15 years. It's a bell-shaped curve, so some are going to be sooner and some later. Gels maybe 20 to 25 years. But occasionally people come in and say, I heard that I need to replace my implants every 15 years. And really, if they're fine, there's no reason to do that because there's a cost involved and recovery and time off work and things like that. So if they're holding up, then there's no reason to do anything unless there's a problem.
And as always, a perfect place to start is to come in and get a consultation before you decide which route to take.
Absolutely.
All right. Thank you so much, Dr. Vasko.
You're welcome. Thank you.